Hello, I'm Graeme Jones. I'm the Director of Infection Prevention for the hospital. Last March we had an outbreak of flu on our stroke ward. Over the course of about 3 days, 15 patients developed symptoms of flu and we had to close the ward as a result. All 28 patients on the ward needed treatment for flu because of this outbreak, either because they had symptoms or we were treating them with prophylaxis to prevent them getting symptoms. We looked at the viruses that we isolated from the tests of these patients and were able to show by genetic analysis that all the viruses had the same genetic code. The transmission between patients was the result of a staff member who probably in the course of one shift they infected all the patients because they were shedding virus and didn't actually take proper safety precautions. Up to 20% of staff members who are not vaccinated against flu will develop infection. The problem with this is that probably 3/4 of them, that's 3 out of 4, will not actually show symptoms of flu or very strong symptoms of flu, and as a result they can pass on the virus and transmit the virus to their patients without knowing it, and also their family. The benefits of staff being vaccinated against flu is that firstly the flu vaccine is generally an effective vaccine that prevents greater than 50% of cases of flu, and secondly, if you do develop flu having been vaccinated, you generally develop a much milder infection with a lower viral load, and therefore you get fewer symptoms, but also you're much less likely to transmit flu to your patients. If staff are protected when they're dealing with elderly patients who have also been vaccinated, you get a doubling up of the benefit of the vaccine. So how best to protect your patients from flu? Well, the most important thing you should do is get yourself vaccinated against flu. This reduces the risk to you of catching infection, but also reduces the risk of you shedding the virus and therefore transmitting it to your patients. Always perform hand hygiene before and after patient contact. Most virus spread is actually from contact with hands and surfaces of healthcare workers. So if you clean your hands, then you can reduce the spread. And finally, if you do have symptoms of respiratory infection, you should discuss this with your line manager. It may be that you should not be performing patient-facing activities that day, or maybe even you shouldn't be at work at all because you are a risk to patients. So the important thing is that flu vaccination may not just save your life, but it may also save the life of your patients.